Hi everyone! Welcome to September at Meld Magazine. My name is Angie and I am the head of Meld Magazine. And today is with me Emily from 1-800-MY-OPTIONS. Hi Emily!
Hi everyone! That's right, so I'm joining today from 1-800-MY-OPTIONS. We're a Victoria-wide state information and referral service.
The reason why she is with me today is because we're going to debunk myths about the most frequent asked questions 1-800-MY-OPTION gets around sexual health.
Let's go! Alright, so STDs is a bit of an older term. Currently we're using STIs a lot more, but they both refer to the same basic thing. So that thing is sexually transmissible infections. So they're things that you can catch if you're having unprotected sex with someone else. So you might have heard of some of the common ones, things like chlamydia, gonorrhea, syphilis, herpes, HIV. So those are different types of STIs. Basically, we've used the term infection instead of disease because it's a bit more accurate as to what an STI is, and it's a little bit less stigmatizing.
That's actually really good to know. So it's better if we actually refer to STI rather than STD, pretty much.
So all STIs are treatable, and you can get them tested and treated really quickly and easily, in most cases, at just a regular GP. Unless you're a doctor and you're looking at someone's blood test results, you probably can't tell if someone has an STI or not. So the reason for that is that the most common STIs, so things like chlamydia in Victoria, don't actually have any obvious symptoms. So you might actually have an STI and you won't even know it.
And that's actually, isn't it funny that people think oh, just because you have a sword on your lip, then you have an STI. It sounds a bit crazy that I can just tell, if you have an STI or not.
Exactly. That's basically why it's so important to get tested for STIs at least once a year.
One of the things about international students is that I know that when you come to Australia, you have to get your OSHC, and that actually allows you to get tested for free depending on whether you go to a bulk billing setting in a GP.
If you've got overseas student health cover, then you can go to a clinic that does direct billing with your insurance provider, so you don't need to pay out of pocket to get those tests done. There's actually some services as well that let you do it completely anonymously and for free. So depending on sort of what you're worried about or where you live, there's definitely services out there that can do STI testing for you in a way that's going to be comfortable for you. I think the other thing that's important to mention is that in Australia, we have really strict privacy laws. So that means that if you go and have an appointment with a doctor, whatever you talk about with your doctor is completely confidential, so no one else can find out about what you've talked about.
I think that's really important because most of international students, they really would be afraid of your dad or your mom or someone else calling to your doctor and be can I have all the information about this person? And I would be terrified if somebody else can access my health records.
I think that's the main thing to remember, that no one else, so it doesn't matter if they're your parents, they're your partner, they're your sister, they're your friend, they're your teacher at uni, whatever it is, no one else can see your medical information without your permission. There's definitely a misconception that you only get STIs from having penis in vagina sex, which unfortunately is not the case. You can get STIs basically from any time there's an exchange in bodily fluids. So that means things like your spit, it means things like your mucus in your vagina or in your anus. It really sort of depends on what type of sex you're having and what type of STIs you've got and how they can spread. But basically, best rule of thumb is if you're having oral sex, use condoms or use a dental dam to stop any potential STI spread.
Yes, that's the short answer. A lot of people actually think that you can only get a vaginal infection from sexual intercourse, which is not true. You can actually get from tight fittings, from not using the right underwear, from using scented soaps, and from using spermicides, or like deep douche, like usually the products that you get in the aisles where you buy your female product.
Yeah, the feminine hygiene products.
God, I hate those ones, and I hate that people are still using them. I hate the marketing around them. They give you everything but happiness.
One of the other things that can actually trigger something like a bacterial infection or imbalance would be stress. So that's super annoying for someone who's stressed all the time. And yeah, just making sure that you're doing all the right things, you're not falling for some of that marketing that's really targeted at making you feel insecure about your body. Yes, you can. No, they are not. If you use 2 condoms, there's actually a high risk of them breaking because of the friction between them, so use them one at a time. Alright, so birth control is also known as contraception, family planning, whatever you call it. Basically, it's doing something to prevent getting pregnant when you have sex. So basically, a lot of really common birth control methods or contraception methods are things like the pill that you take every day, things like the implant that goes into your arm, things like the IUDs, which actually sit in your uterus. So all of those ways are really effective at preventing unplanned pregnancy.
And a fun fact to know for international students is that your GP most of the time is able to prescribe you or to direct you in the right direction as to what is the best birth control for you, because there's a lot of many different birth controls available. So it's best if you always seek advice with a professional GP. Don't just go on the internet and feel like, which one is the best birth control for me? Like, Google is not going to be your best friend in this case.
Yeah, exactly. So I think that's one thing that a lot of international students might be quite surprised about coming to Australia, is that there's a lot of options for birth control, potentially more than in your home country, or potentially just slightly different compared to your home country. So it's always good to know all of your options. And the other thing is, everyone's body actually reacts differently to different birth control. So it's good to know what the options are so you can figure out what's going to work best for your body.
I think also the most important part about it is that when you take birth control, you're taking care of yourself. And you're taking care of your future, you're taking care of your body, of your mind, of your health in general. So I think people should not be afraid of taking birth control. Like, that's one of the great things that I really like about Australia, and that you're able to take care of yourself properly.
Absolutely. And it's not something that, again, you need to tell anyone else about. It's completely your decision if you want to have contraception or not. And it's also something that you don't need anyone's permission for. So you don't need your partner's permission or your parents' permission to access birth control. It's something that's entirely between you and your health professional. Yeah, so a lot of people do get worried about some of the possible side effects of birth control. So contraception, like any medication that you take, can have some side effects. So the thing that's really tricky is that you don't know how it's going to react for your body until you actually try it. So some people might find there's a bit of weight gain, some people might find it affects their moods, but basically most hormonal contraception, over time, the side effects do actually decrease. So it's one of those things that if you do try it, generally over a period of time, your body actually does sort of adapt to it, and you'll be able to get more of the benefits from the contraception than any of the negative side effects. In general, though, birth control is extremely safe and extremely effective. So it's more about trying to see which one works best with your body. And in terms of things like weight gain or depression, or even like risks with cancer, there's actually not very strong links showing any of those long-term health issues over time.
And besides, one of more interesting facts about it is that the reason why there's so many different types of birth control is because each birth control will have a different dose of hormones that will be released in your body, and they work differently. Even if you could have the pill, there's so many different pills available, and they have all different purposes. So that's why it's always best to go to your GP and seek professional advice.